All right, in this video, I want to talk about why so many people really struggle to get results in any program. It doesn't matter if you're talking about a weight loss program, if you're talking about joint pain, digestive issues, sleep issues, any kind of hormonal issues, chronic fatigue, headaches. Think of any symptom that you may be experiencing currently or you have experienced in the past. So symptoms are basically our check engine light, and it's just a reflection that the body's out of balance. And what I want to go through today is some of the variables that actually affect a symptom. This is why you can't isolate or compartmentalize anything. And this is why so many people, again, fall through the cracks in a lot of treatment facilities, is because they isolate and compartmentalize and they don't look at a broader picture. They don't get to the root cause. And what I want to go through today is show you all the different variables. And this is why cookie cutter programs may or may not work. They could work simply because whatever symptom you're dealing with, the particular variable that's involved in that treatment is exactly what you needed. But many times that's not the case, and that's why people a lot of times will bounce from program to program, doctor to doctor, practitioner to practitioner, and not get full resolution of their issue. And so I want to take a look at all the variables and then share a really cool story that actually will kind of put this into perspective. So I had a client the other day. She came to me for low back rehabilitation. She had chronic low back pain for, I think, about 8 years. And anyway, her deep core musculature had really become inhibited. And so there was nothing there to support and stabilize her spine. And so we started to go through the process of rehabilitating her back, and she was doing really good. And her symptoms were diminishing significantly. She had almost no pain. She could really tell that she was restoring the function of her core muscles, and she felt so much stronger. And then she came in the following week, and I was like, well, how's everything going? And she said, well, I had a little setback. Well, what happened? Well, I just bent over to grab, and it wasn't even that heavy of an object. And she said, I felt my back. And so the first thing when someone's making really good progress, the first thing I think about is, okay, what'd you eat? And she said, I've been eating really good. And a lot of times when people say that, they don't always think about some of the things, whether they had a treat, piece of cake, piece of pie, a cookie, whatever. But this particular individual had been eating really good. And it was interesting because when we were going through her nutrition, we actually tested all the foods that she tested highly beneficial for, meaning these foods would create no systemic inflammation in her body. And one of the foods she tested favorably for was tomatoes. And when we tested her, she actually, when she was having her issue, the setback, we tested her and her small intestine was coming up. Well, your small intestine is married to the same core muscles that shares nerve innervation with. So your small intestine, if it's inflamed, it shuts down the core muscles. And she was like, well, how in the world can it be the tomato when I tested favorably for it? So the first question I asked is, was it an organic tomato? And she said, I always eat organic tomatoes, except I went in the grocery store and I saw these tomatoes right there and I grabbed them and they were not organic. Well, when we dug in a little bit deeper, it was actually glyphosates. So many times they're spraying chemicals on these conventional foods, and it wasn't actually the tomato, it was actually the toxin that they sprayed on it. And so if we look at all the variables, we've got the emotional component, circuits and systems. So these are all the different things that can play a role in whatever symptom you're dealing with. obviously we can get into the organs, all the various organs that might be stressed out. So when we when we went into this particular individual's panel, what we found was, again, the digestive system was coming up, and it was actually small intestine. So that tomato that she had eaten, that conventional tomato that had that toxic residue, was actually affecting her small intestine, and then that shut down her core muscles. That also created inflammation in her body. And when a person's been in pain long enough, these pathways from the brain signaling via the nervous system to the back, they become very facilitated. And then what happened is all that inflammation goes right to that area. And so it's one of those things that a low back issue, again, sleep issues, inability to lose weight, you can't have a cookie cutter program because, again, the variables are so different. So we look at toxins. We got dental toxins, biological poisons, food toxins, drug toxins, heavy metals, excess. So like here, we see a lot of people with excess stress hormones, particularly. So these are all things that can create inflammation or stress out your nervous system. A misalignment, it can be everything from a skeletal misalignment. Actually, the connective tissue can be misaligned. The fascia can be misaligned. So these are all things that you can't always judge a book by its cover, right? So you have to get to the root causality of what's going on. And again, that's where we take a look at all the organs, the glands, the systems, the musculature. And because everybody's different, all these variables we have to really dig into. And then if we think about it, the emotional component for a lot of people is one of the biggest hidden factors that people are not getting better. And so when we get into like trapped emotions, we look at all the various trapped emotions that a person can experience. So all these lists of emotions, 1, 2, 3, 4 different trapped energies can actually stress out the nervous system and create that symptom, whatever symptom you're experiencing. So again, you can always cookie cut or have a cookie cutter program and expect results. We see all the time, people will talk about, well, this worked for my friend, this worked for my family member. And these people are well-intentioned, but what works for you isn't necessarily going to work for another person. And we take a look at everything from, there's genetic variables, we've got lifestyle variables. What's super important for people to understand as far as genetics go is any disease process that's genetically linked, it's only about 3 to 4% of all disease processes are genetically driven. The rest is epigenetics. So that's basically your nutrition and lifestyle. That's what expresses the gene. And so when we take a look at any time someone's experiencing something, it's almost always nutrition and lifestyle driven. And this is why, again, we have to take look at nutrition and lifestyle. You've got your misalignments, circuits and systems. And remember, there's a lot of different areas. I mean, the body is so incredibly complex. And so that's why if you're not testing, then you're just guessing. So we always make sure we're assessing, we're testing to get to the root cause of whatever issue a person's experiencing. And so whatever symptom you're dealing with right now, there's always cause and effect. So it's important for you to understand that nothing in the body works in isolation. Everything is a system. And many times one system, if it's unbalanced, then it stresses out another system. So one dysfunction many times begets another. And the next thing you know, a person might have multiple variables that are affecting that one symptom. So if you want to get to the root cause of what's going on, whether you've got neck problems, jaw problems, shoulder problems, knee problems, back problems, headaches, sleep issues, hormonal issues, having a tough time losing weight, call the office, get set up for an appointment. We'll do the assessment. Stop guessing. Sometimes Dr. Google is the worst rabbit hole you can go down just because it doesn't factor you as a unique individual you are. So if you have not gotten assessed or you haven't gone through any kind of testing, make sure you call the office today, get set up. Let's get to the root cause of your problem and get you feeling your very best. So until we see you in the office, go out and make it a great day. You certainly do deserve it. And bye for now.